Thank you, Mr. Chairman. Secretary Burwell, I wanted to draw attention today to an emergency situation I have in South Dakota with my Native American constituents that aren't getting health care. And I certainly know you're aware of the situation, but I want to hear today how you plan to fix it. The federal government has a responsibility to our tribes to provide for their health care because of treaty obligations. And frankly, they failed to follow through on their promise to do so. In fact, in the Great Plains area, we have reports of inappropriate conduct, including nepotism, favoritism, and hiring practices, reassignment of employees who are underperforming or have been poorly trained as well, all leading to very low quality delivery of health care. In fact, a bombshell 2010 Senate report laid out a lot of these allegations, and these problems have been going on for long before I've been in Congress, for a decade or more, and the fraud, the abuse, the waste is rampant in the Great Plains area. And since then, even since that 2010 report, little has changed within IHS. And I know you'll speak to funding levels, but before a Senate committee last week, your acting deputy secretary specifically stated that there has been an increase of 43% in funding into IHS in recent years. So we know we can't simply throw more money at the problem, that there has to be a whole culture change at IHS that has to happen. And what I'm concerned about is that last year, CMS inspections of the facilities in Rosebud and Pine Ridge showed that it was a dangerous situation. In fact, what was so ironic was that CMS said that it was going to terminate its provider agreements to IHS. And the irony of that is that we have one federal agency saying it won't make federal payments to another federal agency when they're both housed within the same department. And it shows the bureaucratic absurdity of the situation we have going on in South Dakota. And at this very minute, my Rosebud tribal members are driving over an hour to get emergency health care services because the IHS's hospital ER was closed due to dangerous care being provided there. So it's not necessarily just funding. There's other issues as well. The mismanagement, the misconduct in the Great Plains area needs to be dealt with. And, you know, frankly, it goes from one administrator to the next. I know that one has recently been reassigned, but then I also hear that he's come to Washington, D.C. to a different position, wasn't necessarily penalized for his lack of doing his job in South Dakota and in the Great Plains area. I want to hear your strategies for how you're going to implement change and culture in this Great Plains region. But I also believe that buried within your IHS budget justification this year, you have a paragraph that says IHS places a high priority on corrective action in the Great Plains area. The problem is that this paragraph appears to be literally copied and pasted from the justifications over the last 4 years. So there's nothing that indicates to me that we're going to have a change. It tells me that, yes, you're aware of the problem, but I don't know that you have a plan to fix it. And frankly, we're putting people's lives in jeopardy in South Dakota, and we have emergency rooms that are closed down, and an agency that will not reimburse another agency because we have people addicted to drugs and alcohol doing procedures on people, sterilization of utensils that's happening by hand washing. So I need your answers, probably written, because I'm out of time. I hope you know how serious I am about this. But if you'd respond to me in written form, I'd be eternally grateful.
Yes, and I would just say this is a place where I think we may need your help as well.
I will help.
Because I am committed to, I don't have a year, I have 11 months and days left.
Yeah.
But I believe we need to get a different answer and outcome. And so this is a place where I may come back to you for help and assistance. Because changing culture is both the relationships on the ground, you know better than I do being from the region. It's going to take a lot, but Dr. Wakefield and I are committed.
Madam Secretary, thank you.